Welcome, Rosemary. And we are going to share, Courtney will share the presentations with you, the PowerPoint. Let me just see here.
Okay. So I'll just introduce myself a little bit, and what I'll do,
yes,
if Courtney's on the line, is what I'll just say slide when you go to the next one. So just make it easier for everyone. And thank you for doing that, Courtney, because I'm so technologically ignorant, I guess is the right word. So my name is Rosemary Romeo. I am a social worker / therapist at Vibrant Healthcare Alliance, and one of my jobs is to provide mental health support and system navigation support for our clients and our community. So I am available to all of our clients and all of our community members that do require those services. And I've been at Vibrant Healthcare Alliance for about the past 7 years. And just to identify, I also am a person with a disability. So ableism is one of my favorite topics. And now we'll combine it with ageism here. So I think it's going to be a fun presentation. I've kept the PowerPoint pretty simple. And then we're just going to fill in a few key points. But I also want to hear from your experiences towards the end. So if you have any questions or experiences you want to share, I am all for that. I think we learn really well from hearing each other's stories. In saying that, I am a person with a disability, but so far, and I do hope to be an older person one day, but for now I'm not. So I don't have those lived experiences of experiencing ageism on that level. So just keeping that in mind. Yeah, okay. I understand there are people over the phone, so I do want to try my best to be as descriptive as possible. With the slides and so on and so forth. So we will try to make sure of that as best we can. Now, this topic is ageism and ableism, how people treat you and how to challenge it. So we are going to talk a little bit about today about ageism and ableism, how they intersect, some of the ways that our, I guess, stereotypes and the negative stereotypes have been constructed. And what influences us, as well as how it impacts us. And of course, how to challenge it, because, you know, why not, right? We definitely want to do that. So to get started, I guess we'll put the first slide up after the title, Courtney there. To get started, we want to talk about what it really means to age, or what it means to get old. So taking a look at this, we cannot answer this question without keeping disability in mind and reflecting on disability, because as we get older, there may be many invariabilities that lead us to perhaps becoming impaired and becoming a person with a disability. Also, the characteristics and the negative stereotypes that are alive in ableism tend to be alive in ageism. So it happens to be, you know, go very much hand in hand that way. And I think that's something, again, as we get older, we have to keep that in mind, that even though both of these types of oppressions are separate, they are also very combined. So it's a lot of the negativity and negative judgments and stereotypes that persons with disabilities at any age experience, older people may experience as well, as they do either become a member of acquiring a disability or not. Okay, so there are several, like we said, several shared myths. A lot of them and stereotypes, and a lot of them tend to be negative and socially not undesirable. So we all age, and so we may identify as having a disability eventually, although disabilities sometimes can be at birth, or we can acquire it. So that's something to keep in mind. So someone like myself, I have been a person with a disability since birth. And as I get older, I'll still continue to be that. But I will also probably experience, you know, as I get older, ageism and those types of situations. Now, something to keep in mind too, when it comes to disability and age, is that it intersects with all types of social locations. So what I mean by social locations are race, gender, sexual orientation, religion, class, all of that. It does not matter if you're rich, poor, black, white, gay, straight. You have we are aging, of course, and we have a chance to acquire a disability, like I said, again, at birth or as we age, or get into an accident or so on and so forth. So these two types of oppression definitely intersect all of them. So I may not experience living in the Western society and identifying as a white passing person. I may not experience racism as someone of color might experience, but someone of color can experience ableism. So that's just something to keep in mind as we progress. So the next slide, please. So when we get down to the core of what ageism is, it was not identified until 1969 by psychiatrist Robert Butler. And he basically talked a little bit about how it is basically one group has negative prejudice against another. And he put it as age group. Now, he really focused on just age, so young and old and so on and so forth. But as he continued to work with his clients, he noticed that there were lots of negative experiences as people got older. So then he really added that, ageism has a lot to do with, basically it's a process of systemic stereotyping of, stereotyping of and a discrimination against people based on their chronological age. So he found that, based on being old. So he found that the older you are, the more discrimination that you experienced. So even though a young person can experience ageism from an older person, the impacts were not as significant as the other way around. So he really put that forward. And again, listening to his patients and their experiences of aging and the pressures that were put onto them, the systemic barriers, the negative stereotypes that they experience, the treatment, he really made a change to that definition. So basically he was, I guess, for lack of a better word, the father of ageism. And he definitely came up with that term. And not to be, repetitive, but again, it could be experienced by, it can be experienced at any age, and it also does cross many intersectionalities. And I personally think that ageism obviously has been alive and well since probably the beginning of time, to be honest, at the beginning of human civilization, I should say. And if someone did get old a few millennia ago, it was very an anomaly because people didn't live that long. But I do think it was something that was alive and well and continues to be. So I think it's definitely an issue we need to pay attention to. Next slide, please. Okay, so we're going to focus on this next slide is what is ableism? And so ableism is the negative stereotypes, discrimination, and prejudice towards a person or group of people based on their physical, sensory, mental, cognitive functioning, capacity and or limitations. So basically, you're judged based on having any of those differences. So now, disability is not something that has a clear, agreed upon definition. So there are many groups in the disabled community, in different types of communities, that do not have an agreement to say this is what a disability is and this is what a disability isn't. So some groups would say, well, if you need an aid to help you do something, for example, using a cane or using glasses to see or hearing aids to hear, you are considered a person with a disability. Whereas others say those are not necessarily going to make you a person with a disability because they're just, they're minor. Like a lot of people wear glasses, right? So it's not considered, someone who wears glasses may not have what considered 20/20 vision, but they don't necessarily fall into being a person with a disability. At least we don't think that way, because I think the more common use of glasses may have sort of eliminated that difference or that barrier. Because if someone with, so for example, someone's using a wheelchair and someone's using a walker and someone's using a cane, all of them are elements that are helping a person be more mobile. But we view them on different categories, on different levels. So because of the variability, we have not had an agreed upon consensus of what is considered a disability and what is not. So that has gone on for many years. So people have written papers and books and all that kind of stuff and lectures all about what we can agree upon. So, but just based on that, you know, most of the time, the common acceptance is defined as a physical, psychological, or cognitive a condition that limits a person's function, or sorry, movement, senses, or activities. So that's, again, what do you consider being limited? That's something that we really have to look at in terms of how we define that. So, yeah. Again, disability can be congenital at birth, or it can be acquired later on in life due to a condition or an accident. And disability also, again, like age, can cross many lines, many social locations. And again, a disability can also be temporary, which is something we don't really focus on. But for example, if you had a surgery, you were unable to walk for 6 months, let's say it was a knee surgery or hip surgery, you may be using a walker, a cane, or even a wheelchair, and you may fall into that category of what considers to be a disability for a temporary period of time. So when you see a person using a wheelchair, you don't know if that's a permanent disability or somebody's in there temporarily. So they may experience ableism just based on using a wheelchair at that particular time. So it may not necessarily be a permanent disability. So we always have to be mindful that those temporary situations can happen. And sometimes that's ignored, right? So a person could be really shocked about that. So next slide, please. So the intersection of age and disability. So again, we touched on this a little bit previously, but as we age, the likelihood of acquiring a disability or changes to your health and functioning is kind of high. So again, the intersectionality of both ageism and ableism is quite high. And, you know, that is also, again, intersections with other forms of oppression as well. Again, not to sound repetitive, but that's really something to keep in mind. It is something that is across the board. A person can be the rich, although obviously there are certain factors that can contribute to a person's level of oppression. For example, a richer person who is older with a disability has it a little bit societally easier, if we want to put it that way, than someone who is experiencing poverty. Of course, based on the disability, based on the culture as well. Culture is a big thing as well. So in my culture, seniors are revered. It's not a thing. It is a blessing to get old, and it is a very much desired situation to get old. So it's not. We don't look at aging, or as I grew up, I didn't look at aging as a bad thing. You know, every birthday it was like, well, thank goodness we got to the other year, and we continue, and we want to learn from our older people. So in certain cultures, in certain parts of the world, we are not going to have that. Perhaps that negativity around that. So it all depends also as well on where a person, what they believe in, what their culture is, so on and so forth, and how the people around them treat them. You know, are they pushed aside? Are they ignored? Or are they listened to? Are they valued, right? So that has a big impact as well. Let's see here. Yeah. Okay, I just, like, again, I don't want to sound repetitive, so I'm not going to always go through everything specifically there, as it is a bit repetitive. Okay, so the next slide, please. Okay, so we can all agree that any form of oppression is based on negative stereotypes, discrimination, prejudices, our beliefs, our behaviors, our actions towards a particular person or a particular group. So when we look at this, we think to ourselves, well, what influences this? And we feel that a lot of the times, a lot of our interaction with these elements are not always so clear cut, right? It's like, well, I don't know. Oh, I think we're ahead of, hold on a second, I'm on the right slide or not. Maybe I skipped ahead. Oh, can we put the slide up of what influences us? Can we put that one up? Sorry, I'm not on the right slide. Okay, there we go. Thank you. So what influences us? So like I said, negative stereotypes, are formed many different ways. And sometimes we don't, we're not always clued in on how it impacts us. But I want to look back at our childhood, right? Because our childhood experiences are huge. Me being a therapist, that's where I always go with clients. So it's something to keep in mind. What did your parents believe? What did your community believe? Your interactions, with your school classmates, teachers, what was taught to you? That is a very big impact for sure. And it's something that we're not always aware of. So sitting in school, what were the images, if any, of persons with disabilities? What was, promoted to you? What was, what did your family think about it? So, that really is a really big form that influences us that we do forget. So the first, few years of our life, it's very important. So all forms of media. This one is another one. So obviously print, television, film, radio, social media, all of these things, and these are continuous, right? We interact with these a lot. So it's something to also keep in mind. What is, when you watch a television show, when you watch a movie, what is the portrayal of an older person or an older person with a disability? Is it negative? Is it positive? Is it patronizing? It's like, oh, well, this person overcame this, let's put them on a pedestal, or is it sort of a normal kind of portrayal where a person may have be a valued member in their community, so on and so forth. Social media is huge. I'm not the biggest fan of social media myself, but it is very much used to share stories and experiences. So what is out there as well? And it's not as, for lack of a better word, controlled. I know it can be censored now, but it's not as controlled perhaps as print media or television. But it is still very impactful, especially to the younger generation, informing those perceptions of older persons or persons with disabilities. Government institutional systems. Now, this one's a big one as well. Healthcare is incredibly ableist, is incredibly ageist. The education system, a lot of the time, if someone who's an older adult goes into university, or someone with a disability who's an older adult as well, it's not always as accepted, or some heads might turn because it's not the norm there. So there's a lot of barriers to that. Employment is huge. The employment sector, a lot of people I've spoken to over the years have always told me that as they get older, as they age, they do not get the same opportunities for jobs as a younger person, despite how much experience they may have. So that's definitely alive and well in terms of being denied jobs, being denied access to meaningful employment. Social, recreational, I think of sports, I think of entertainment, recreation. So for example, certain restaurants, are they catered, are they accessible? Are they catered to an older population, or they just want to, hit the young people, right? And I was told this by someone who worked at a restaurant once that said, they're trying to get a certain crowd. So certain people were the ones that they would seat near the windows, right? And so if you didn't fit the criteria, perhaps if you're older, disability, who even knows if it was even like race, gender, whatever, you might be seated at the back because they wanted a particular portrayal in the front, and that was what their bosses would tell them. So, we make the assumption that young, hip-looking people, perhaps of a particular culture, I don't know, we didn't get into specifics, but something like that is alive and well as well. In sports, it's getting better in terms of like some of the recreational activities, gyms, and like marathons and races where they include all groups. So that has definitely improved, but still has something to, we still need to work on that as well. So again, all of these things, touch upon that. Again, cultural, social beliefs, that's a big thing as well. And that sort of matches all the fabric of what we mentioned before. But again, the Western culture, as opposed to some cultures from different parts of the world. Like I always think about Japan as being very, very open to older people. They often work up until they don't want, excuse me, they don't want to anymore. So if they're in their 90s or 100, you know, and there's an island off of Japan that has the most 100-year-olds, right? So they're alive and well there, and it's a very respected thing. So that's a different cultural view that if someone who is born in Canada, maybe from a Eurocentric background or perhaps a British background in terms of how they might see someone who's a senior and someone who might be raised in Japan. So again, that does keep it in mind. Religious beliefs as well. Again, religious beliefs go down back into culture. There's a big mix in terms of that, so big blending there. And again, structural barriers, we talked about sometimes the inaccessibility of certain, and now the structural barriers across everything, right? So across businesses, across healthcare, across institutions, you know, that's alive and well as well. So next slide, please. Okay, so we definitely want to focus a little bit on, you know, how, now some of these myths are pretty common, and when I say they, I mean persons who are older with disabilities. So this is what this means. So we're going to focus on some of the common ones. Now, this is where I want our participants to jump in to add a little bit. This is what I found in the literature, and also from my experience of working over the years. I have been in social work for the past 16 years, so working with a lot of seniors and have heard a lot of stories. But these are some common ones that I've come across, and please add to it if you have any. So basically, you don't have the ability to participate in meaningful work. A lot of the times you get older, you're forced to retire, or, you know, that's what is kind of expected of you. A lot of jobs are not available to you. You know, often we'll say, well, you know, if a person has all this experience, well, we just push them aside, or maybe volunteer, we don't pay them. You know, if a younger person's going for a retail job over an older person, the younger person might get that job. So there's many exclusions there, and I've seen that quite a bit, and that's the biggest one that has been a common theme throughout my career and throughout what I've noticed. And then the next one is also something that I've seen, but they are a burden on their family and friends. Basically, they're dependent on society, right? That's not true, but again, that's something that is put forward. It's like, oh, you know, my parents are getting older, I have to take care of them. That's a theme that's very much pushed forward. Or, you know, somebody has a disability. Oh, well, I need to do this for them, right? I need to just take over and you know, do things for them. So again, that sort of burden mentality is very much pushed through in our society. They cannot learn new things, right? So that whole saying, you can't teach an old dog new tricks, that's not true. Obviously, a lot of people do continue to learn, lifelong learning. They go on to universities. There's a bunch of university courses that people can take that are available to older adults, and so with disabilities as well. And also, we assume that they cannot learn as quickly as a younger person. So back to the job situation. So if a person with 30 years of IT experience goes in for a job, and a younger person who knows how to use maybe social media goes in for the same job, they often will take the younger person because they assume that the skills that the older person has learned are out of date, and they think, well, they can't really learn as quickly as the younger person, so I'm going to give that job to the younger person. So we make those assumptions, or not we, but a lot of members of our society do. So we have to keep that in mind. So they do not know how to or have any fun. Now, this one again, in terms of how it's portrayed in the media. Oh, you get old, and well, you know, you stop living, right? You stop working, you stop traveling, you stop doing this, you stop doing that. So there's that expectation, or that assumption, or that negative stereotype that older people don't know how to have fun. And then when there's movies that do portray that in a good way, like or shows, I think of Grace and Frankie on Netflix. If anybody sees that, that's a great portrayal of just, you know, living your best life at an older age and really enjoying it. But again, some of those themes, some of the themes of ableism and ageism do come out in that show as well, if you're aware of it, especially when Jane Fonda's character has knee problems, right? So, you know, again, it's very much there as well. They're draining the healthcare and social assistance system. So, you know, well, they take up so much time and energy for healthcare providers, right? And they drain the pension and systems and, you know, social assistance or, you know, hand-me-downs, so on and so forth. And this one really rang true to me when I was thinking about it with COVID and how the long-term care systems were, you know, dealt with, you know, and how people thought about that, and how government thought about that. So that really stood out for me as well during this time. They're not beautiful. You know, it's not the older person with a disability on the cover of Vogue or the cover of People magazine often. It is a younger photoshopped version. Also in items or products that are supposed to be sold, for lack of a better word, to older adults, they often use a younger person to sell it. So hair color. I know someone who did a commercial on hair color. She was 24. So, and she's like, it covers my grays. I'm like, you don't have any grays. So again, that's just very much promoted that way. And there's nothing wrong with gray or white hair as well. But so that's another thing that is put forward by societies, like cover that up because that means you're getting old. And if you're old, you can't be beautiful. Oh, what happened? Okay. Of course, they're not healthy is another one. We don't assume, again, that they're not, well, you're older and therefore you must have a lot of healthcare problems. Again, with COVID, that was put forward. An older person is more likely to be at risk because they're more likely to have other issues. And so that's not the case. An 80-year-old could be healthier than a 40-year-old, but there's that assumption that the older you are, the less healthy you will be. Yeah, and they don't have intimate relationships. This is another one that is put forward, especially in television and film. It's the older person, but they don't really know how to have, you know, those intimate relationships anymore, or nor they have the desire, which again is very false. If we look at the information and literature behind that, that group is thriving with dating and so on, and having some fun and expressing their sexuality. So that's something else to keep in mind. Next slide, please. Okay, so what are the impacts? If we think about the impacts of all of these negative stereotypes and, you know, for older people, persons with disabilities, and specifically in ableism and ageism, they're more likely to experience some of these. So financial stressors, because a lot of older adults with disabilities may not have access to work or meaningful employment or get paid as they should, they often might experience that financial stressor. They also might be taking care of younger people as well. So that could lead to obviously poverty as well. You know, physical and financial abuse and neglect, huge, huge. This is something, an ugly secret of society that nobody wants to talk about, but this is huge. In, you know, private settings, in public settings, long-term care, hospitals, you know, private caregivers, family.
I just want to say one thing about that.
Sure.
When we had the topic just a couple of weeks ago on elder abuse, yeah. I mentioned in that thing that we should be calling it elder disabled abuse because it's the whole, because the elder and the disabled are both, in this case, the same thing. Okay, well, thank you for that. Definitely, you know, and it's appropriate for this topic because it is, you know, there is that intersectionality. So good point there. Thank you. Yeah, I wonder how they would change that term. It's a good way to put it, but I'd love to see that change come in the literature. But that, like I said, it's huge. It is absolutely huge, and this is something that is not talked about at all. And sometimes there's not even penalties for the people who perpetuate that abuse, or sorry, who put that abuse forward. Food insecurity. So this one is also a dirty little secret. A lot of seniors don't have access to food that they want. They often might not be able to go out and get it, might not be able to afford it. And so there's tons of barriers to food security. And also, I learned, I did not know this, so you guys can jump in and help me out here. I just learned that grocery gateway, like those delivery services, if you use the phone to order your groceries, there's an extra charge than if you were to go online to do it. So that's another barrier. Why, if someone chooses to talk to someone over the phone to put a grocery order in, should they be charged more just because they're not going online? You know, so things like that, really, we have to take a look at. And sometimes you don't have
something like
Yes,
that's going on. That's actually a breaking of the rules under ODA and the Canadian Disabilities Act.
Mm-hmm.
So what they could do is, if they want to allow people with disabilities to use the phone, then maybe what they need to create is a Canadian disability card that allows you to get reduced fees on certain things.
Yeah, that could be something, but it's the Canadian with Disabilities Act, or the the Ontario with Disabilities Act. It really needs to step up a little bit, because a lot of people are not following those rules, and definitely as people might get older, they experience this as well. They're like, well, this wasn't an issue before, now it's an issue.
Sorry, excuse me,
yeah.
Rosemary. Everyone, I just want to ask you to keep your comments and questions for the end of the presentation. We'll have the Q&A after the presentation. This way we don't need to interrupt Rosemary's presentation. Okay, thank you.
All right. Okay, so just, we're almost done here. So just obviously unemployment we talked about, again, as a big impact, barriers to healthcare, barriers to education, and barriers to information and communication. That's a huge one as well. Websites are not always helpful. I think about COVID-19 and having to book your vaccines online. I don't have any grandparents left, but if I did, I could tell you they wouldn't even know what a computer looked like. It wasn't part of their life. So that would have been a barrier to them. And if they, especially if they lived alone or isolated, so that's huge as well, in terms of what the system creates there. Information technology and communication is a huge barrier. And of course, barrier to stable housing. What I mean by that is, if you acquire a disability later on in life, you may need accessible housing, and that's not always available. So that's something to keep in mind. Next slide, please. Okay. All right. So based on what, it is pretty common out there that persons who are older with disabilities experience, there's lots of negative, obviously negative outcomes. So obviously day to day you experience these. These are not things that are like, well, they just happen once in a while. They're pretty common, especially in the Western world, like I said, or Western society. So they can lead to some very, very significant consequences. So older adults with disabilities, they're more likely to experience depression. Now that's something I've definitely seen in my career. So depression or other mental health conditions, that is huge, just the process of aging. So they tend to experience more isolation. We've seen this with COVID in general. I mean, that's something that was highlighted, but again, very much isolated. We know that is a factor. And that, of course, plays with, leads to how a person thinks about their mental, physical health, their relationships, and so on. So that isolation is not a good thing for our health. We know that more isolated people tend to have more negative outcomes with health and social experiences. Okay. Older adults with disabilities, now they report feeling basically excluded, just like this. Now, so there's several studies that I looked at, and this came up a lot, where basically they were excluded from many, many different things. There was not many positive media portrayals of them, representation in certain institutions, groups. policies, you know, a policy about disability and older age sometimes didn't even have a person who represented that. So making these laws and rules, maybe about ODSP or pension benefits or CPP pensions, so on and so forth, there was no representation. So again, there was not much equal opportunity for them to share their experiences. Okay, next slide. I'm just trying to be mindful of time because I want to leave time for questions. So I'm sort of glancing through it and hopefully not missing out too much here. Okay. Okay. Okay, can go to the next slide, please. Okay. And I felt that, you know, how do we fight back? Obviously, it's knocking out ageism. So we tried to use that as a way to you know, have a pun on it. So again, just trying to go through these a little bit quickly, but obviously keeping them in mind. So over the years, there has been an improvement towards the way the older persons with disabilities have been treated, but a lot of work to be done. It's not perfect. So what do we do? Where do we start? When we look at this, we have to start within ourselves. So any change starts within ourselves. We have to look at how we view aging. How do we view having a disability or the potential to have a disability? What are our thoughts about that? You know, are we sad about that? Are we sad about aging? Do we embrace it? Do we look at disability as limiting, or do we look at it as just being different? You know, so we have to, well, we went back a few slides ago when we talked about what influences us. We need to look at it. We need to explore our childhood, you know, our interactions with healthcare, education, employment, so on and so forth. It's very important to take a look and start there, because if we have a negative stereotype of aging, a negative stereotype of persons with disabilities, we're not really helping our cause, right? So as we get older, if we don't believe that we are capable of, you know, being active, full participants in society, then we're going to just perpetuate that oppression and within ourselves as well. Educate. So this one's a big one as well. Education is the only way, in my opinion, or one of the only ways that we can stop these forms of oppression. We need to help people become aware. So we need to educate. We need to educate ourselves, like I said, and we have to educate others. Now, there's a bit of a pressure to be that educator. You're like, oh, why do I have to do it? But sometimes the best stories are the stories that come from lived experience. So when you do experience something like that, something like ableism, ageism, combination of both, putting it together and educating other people, changing their perspectives. We want to look at evidence-based literature, studies. You know, we don't just want to throw out a stat. We want to look at that kind of information as well. We want to take a look at trends. We want to stay up to date as much as we can to help our cause. We want to talk about our experiences, not just go on through life without sharing it. That's a really big important thing. We don't want to be ignored. You know, we don't want to have that happen. So yes, contributing to the education. Although it's exhausting and tiresome, it's important. It's important to share your stories. So write them down, speak up, get out there and educate. And when you have those opportunities, especially. Next slide, please. Okay. All right. Okay. Thank you. There we go. Okay. So we want participation and representation. So this one's huge as well. So just because you reach a certain age or you have a certain disability or both, like I said, we don't want to just isolate, shut down and isolate. We don't want to be a turtle in the shell. We want to get out there. We want to represent. We want to make changes in our community policies. We want to maybe become a board member, a member of a committee. We want to get out there, volunteer, work, protest, whatever needs to be done to be seen. You do not want to be ignored. We can, you know, for so long, if that is, you know, persons with disabilities who are older, we're not out there, we're not visible, we're not seen, well, then they don't exist, right? Right? Nobody's going to think of it. But if we start getting out there and making those changes, and I know it's hard work, but I think, you know, as a collective, it's important because these two, like we said before, ableism and ageism, these two are going to be maybe experienced by a large quantity of people. And so we all get out there and make those changes, I think, and here have your voices shared. It's important to get out there and be active, represent. We want that representation. Now, we want to also look at challenging some of these stereotypes, some of these views. Now, we have to be mindful that a person who says something or does something sometimes does it completely out of ignorance. They're not always aware. Awareness is key, but people don't always have it. So we have to keep in mind that we have to be kind, but continue to educate and point something out and speak from your perspective, right? I did not appreciate this, or whatever the situation was, because you don't want to feel undervalued, you want to feel ignored, you want to speak up. So when you have a chance, do it kind, do it gentle, but do it if you have an opportunity to do that. And of course, the last one here, basically live your life, right? Do not allow the media, people, society to tell you what to do. Do not stay in a box. Just because you get older, may acquire a disability or have a disability, do not be limited to what others think you should be. The more you get out there, the more you can, and you can also represent, right? Like you're the person playing, wheelchair basketball at 80, great. If you're the person who decides they want to write a book when they get older, get out there, do what you want to do. Disability sometimes is just a different way of doing things. It's not a limitation. So yeah, that's, I guess that's about it with that. And I have questions. And then as we're doing the questions, you can pop the resources up if people want to just take a look at where I got some information and where they want to, if they want information further. So yeah, it's just the questions. Yeah, and then some resources at the end. We could just pop that up as we ask questions, so people want to take it down. For those of you on the phone, maybe we can have that sent out to you if needed. But yeah, so any questions?
Have you thought about, the problem with, let's say, even with when I'm on ODSP, the government thinks that I can't manage the wheelchair. They don't want to give me an allowance to manage the chair, which would actually save the government tons of money.
Yeah, there's many problems in the ODSP system.
That's why legally it's got to be called the Ontario Disability Shafting Program.
Yeah, it's they were supposed to have a revamp of it prior to Doug Ford's government. And then that didn't happen because, when Kathleen Wynne's government was in there, but then that didn't happen because Ford came into power, so they changed it. So.
Yeah. And the thing is, because I'm disabled, I was able to teach other people to do other things. And here's a good news story that the TTC has done, but they actually, besides helping the disabled people, it ended up helping a lot of people that were able-bodied too.
Mm-hmm.
Are you ready for this? You know the stop announcement system?
Yeah.
Right? That tells you which stops are next when you're on the bus?
Yes.
Now, there's a lot of people that are on the bus that are not disabled, but in the wintertime, you may not be able to tell where you are because you can't see the streets from the window and stuff.
Yeah.
But the stop announcement system was a low-cost solution for people with the blind, but it actually turned out to reducing navigation errors for a whole lot of the people too.
Yeah, so David Lepofsky, who was a lawyer, put that into place. He's a blind lawyer. But also, if you take a look at persons with disabilities, what makes something accessible, it's easier for everyone. Let's face it, ramps are easier than stairs, right? They limit people falling. They're just easier than stairs, but yet stairs are what people go for first. Yes, sitting on a bus and having a stop, or sitting on a bus or a subway and having a stop right out to you is great, because if you have your head down reading, whether, or doing something else or paying attention somewhere else, it reminds you where you are. So, a lot of people, accessibility benefits everybody.
Yeah, and that's what the government doesn't understand. And like, for example, the government doesn't realize if they were to change the ODSP rules where I'm allowed to make up to $6,000, but it's based on what I make in a year, the government would, even though it looks like the government would be wondering, it's going to cost us too much money to do it, but in the long run, it's going to save them a ton of money. because then I would have pushed hard to try and get a job or whatever, and then get through the whole process. And I know I'm not going to lose my money right away until I get that cushion built first, you know?
Yeah, absolutely. Again, the government doesn't always think about prevention and what makes it easier for people. They just think about money sometimes, and they don't want to spend it up front. But you're right, it will save things down the road.
Yeah, definitely. And with the accessible subways that they're putting in, I took a trip yesterday that I could not have planned for by Wheel-Trans at all.
Right.
Something came up and I had to get over to the hospital. So I couldn't have planned that trip the day before. But I took care of it and everything went fine.
That's good. That's good. Any other questions or comments?
I have a comment.
Teresa?
Hi.
Hello.
So 2 things. Number 1, I've been looking for a job on like LinkedIn, and what I notice is all the jobs being offered right now are entry level, which kind of sucks. And also, you mentioned the ramps. I'm not sure how expensive they really are, but when I was living, right now I'm at Don Mills, but before I was downtown and very close to Queen Street. And, you know, there's a lot of really great stores on Queen Street, but most of them I couldn't get in because they didn't have the ramp.
Yeah.
And one of the people, I said something about it, and he said, yeah, but the you know, it blocks the sidewalk for everybody else. It's like, well, yeah, but it doesn't really block the sidewalk. There's still space.
Yeah.
And you know, so they can, you know, step over the ramp, or, you know, I mean, apparently in 2023, everything is supposed to be, you know, accessible to those of us in wheelchairs.
Well, look, I do hope that, Teresa.
Actually, it's supposed to be probably done by 2023, but the regulation is that the Total Disabilities Act does not take effect totally until 2025.
Yeah,
It keeps getting pushed back.
Yeah, I do hope that, but it has been pushed back because I remember when I was younger, it was 2020. Obviously, it's 2021. So, yeah.
I understand that COVID might have altered things, but by the same token, a ramp is a ramp. You know, just get your damn ramp out there.
Well,
there are also a lot of really small stores, and they have so much crap that, yeah, I can get in, but then I can't move around.
The situation there, Teresa, too, is that anybody, for lack of a better word, able-bodied or not, should boycott those stores. We should make it an issue. We should make it important for everybody to have access to the goods and services that anybody sells, or restaurants, or so on and so forth. We need allies, right? If it's not, they don't view that population, older persons with disabilities, as important, they're not going to make it accessible.
And then there are the restaurants that put the ramp out there and make it accessible. Yeah, we'll move the chair so that you can put your chair, but then the washroom is downstairs.
Yeah, the washrooms are not accessible, exactly.
It's like, well, okay, you guys did a half-assed job here. I don't know. I wasn't always in a wheelchair. I've only been in a wheelchair since the end of 2019. But I am a dwarf. So I guess I never identified as disabled when I was a dwarf. I mean, I just didn't, because, you know, people would look at me and go, wow, you're so amazing because you drive and you go to work. It's like, well, yeah, what do you want me to do?
Exactly. Yeah, you just do it in a different way. It's not like you're.
What do you expect? That I'm just going to sit in my home and twiddle my thumbs and, you know, be miserable?
Exactly. Exactly.
That's what you're saying. You expect me, it's like, wow, you drive? It's like, well,
Mhm.
yeah, I drive.
Yeah, and people don't realize that that is ableism at the core when they're complimenting, or for lack of a better word, or putting someone with a disability on a pedestal. It's not, that is ableism. It's not, people with disabilities just are doing it in a different way. It doesn't mean that they're amazing, incredible individuals that overcome incredible barriers. The barriers are there because persons who are able-bodied, for lack of a better word, put them in place. If we didn't have those barriers, it'd be a lot easier.
I appreciate you saying that, because I found that many times when people would say something like, wow, you're so amazing, I didn't take it as a compliment. It kind of pissed me off.
Good. It should piss you off.
It's like, pardon me, but fuck off.
Yeah.
Like, I realize you think that you're complimenting me, but you're kind of not. You're just saying, like, anyway, yeah.
Yeah, and just to quickly say something about that, Teresa, then what happens is if you do something that is amazing, let's just say you, I don't know, develop the cure for cancer, you get the accolades, but you won't believe them because you're like, oh, you're just bullshitting me because
Yeah.
you put me on the pedestal again, right? So again, that's a very, it's a common theme for
Yeah.
sure.
We have time for one more question.
So I just wanted to say one other thing. So what the government could have done during the pandemic, because most of the stores were closed, the government should have said, okay, make your place accessible. We'll write it off your taxes.
Yeah, for sure. Again, accessibility should be a priority.
And it should be in the tax code. And those who don't do it after a certain amount of time will pay fines, and then we'll have to count it as income.
Right.
Those who finish early will get a tax credit.
Yeah.
Okay, I think any more questions? I think we are good. Well, thank you so much. Thank you all for participating in this session. Rosemary, you are great. Thank you so much. We appreciate it. We will see you in the next series, and series number 2 and series number 3 as well.
Sure.
We look forward to seeing you again. And thank you all. This presentation was recorded and it will be available on our YouTube channel soon. And see you in 2 days.
Yeah. All right. Thank you, everyone.
Thank you. Bye.
Thank you. Bye-bye.
Weekend, everybody.
Have a
You
good
too.
week.
Bye-bye.